Namaste. Thank you, Dr. Subramaniam.
Thank you, sir.
It is such a privilege to welcome all of you from around the world. I would say good morning, good afternoon, good evening to all of you. And for this Asia Pacific Interventional Conference, I remember the first conference that took place was Khanna again. He was involved in bringing Michael Henry, who is a great friend of ours from France. He has participated in training several of our people and coordinating with several clinical trials with her. And the first conference which took place in Delhi with active way Dr. Professor Khanna worked that time is wonderful. So today, it is the Asian Pacific Interventional Conferences have played a great role in bringing out how we can tackle disease better, what more we can do for our patients. There are great things that have happened over the last 2 decades. Being a cardiologist, I know what it was 4 decades ago and what the development that will take place. All this we could absorb in India, in all our hospitals, because of the kind cooperation from several institutes. I think that's significant. The number of conferences that we had and the attendance that we have from international faculty. Even today, I understand more than 50, 60 faculty are there, and many doctors from across the world are connected today. But thankful to all of you. But first, I'm very happy that today, Dr. Farid Murad is giving the oration. We have great interest because he is a Nobel laureate in discovering nitric acid role and then coming on into several disease and drug manufacturing, which helped a great number of people. So I went through the number of honors he has had and also the various institutions he has worked. It was very interesting with me that Dr. Farid, I was at Mass General just a year before you. Before you went, you were in Mass General between 64, 65. I was there 63, 64 as a fellow of cardiology. So I'm happy that to see that one of the great institutions you worked was also Mass General Hospital. And I have, going through your biography, I would say your contribution to humanity has been tremendous. And I think we all play our own role. In India, we started Apollo. Today we're about 70 hospitals. But our prime care thing is to see what more can we do for our people. See, this decade, everyone knew World Economic Forum warned us that communicable diseases, non-communicable diseases, the heart disease, the strokes, cancer, and infections, is going to play a very major role, and 80% of the deaths will be from NCDs. We are preparing ourselves, and just we are about to launch in February a new program called the Pro Health to protect people, detect NCDs early, so that we can save many of them. But unfortunately, just that time, when about to launch, the major pandemic broke out. So we are holding that back, but it's not that we are not treating COVID patients, but what our interest was to bring the awareness into people so that they come early. If you diagnose early in cancer, 4 years ago when we had an international conference, they called Cancer is Conquerable. 2 years ago when we opened our proton center, we had an international conference. At that time, they said cancer is curable. So I think even cardiology, there have several significant things that happened. We have none other than the great Dr. Farid Murad and distinguished international faculty. As I said, I thank the number of faculty who have participated and done clinical trials education with Apollo, and for which I really appreciate the several institutions and the leaders in various development. I thank them all, and I'm sure today is going to be a very interesting day. Before I could say welcome, I must again mention Professor Khanna. Professor Khanna was one of those enthusiastic persons. From day one, he joined us. And he did his cardiology work, but he was very much interested in to see what more we can do. How can we learn from other institutions? This is, I think, been the overall Apollo philosophy to see, yes, we are doing good things, but there are many good things, many more better things that we need to learn. So, Professor Khanna, I congratulate you for conducting again this conference today. And I'm sure with the oration that we have today, and the many, I can't mention the number of dignitaries that we have here. I will only say, I remember Henry, that Michael Henry at that time from France, and today we have the most distinguished Nobel laureate with us. I welcome him, and I welcome all of you. And I'm sure this will not only be a great oration, but it will lead us to see what more we can do for people at large. God bless all.